Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Murlidhar M. Kulkarni, who is Associate Professor in Department of Community Medicine, Kasturba Medical College, Manipal, Manipal Academy of Higher Education, Karnataka, India. A very warm welcome to you, sir, on behalf of all the audience.
Thank you, Dr. Ritu, and thanks to IAPSME Connect for giving me this opportunity to express my views on preventing tobacco uptake among adolescents. Thank you so much.
Right, sir. As sir has told us that we are going to talk about preventing tobacco uptake among adolescents, because this is the issue which is very harmful. We all know that this is a very harmful, but still there are so many population, so much population who is using tobacco still. So today we will talk on that. So may I start the session, sir?
Sure, please.
I would like to start with my first question: that what are the factors influencing adolescents to start using tobacco?
Yeah, because everybody knows, as you told initially, that tobacco use is quite high in our population, and there are several measures which are taken to see to it that people don't start using tobacco. At the same time, those are using quit it, and I think people are aware that once anybody starts and they're addicted to it, it is very difficult for them to quit the habit. No, it's Herculean task for the healthcare providers as well as the people, those who have got addicted to this habit. Now, there are several measures which are taken in order to prevent tobacco uptake among adolescents. So, if we need to prevent uptake among adolescents, we also should be knowing what are all the factors, what makes these adolescents start tobacco use. So several studies have been done, not only in India but and in other countries as well. In India also there are several studies which have done and shown that comparatively males or the boys tend to hook onto this substance compared to girls. But in the recent surveys also it has come to light that girls it's increasing. So male gender is one of the risk factors. At the same time, we also see that people who are from poor socioeconomic status, so they are having at risk, they are vulnerable, they are likely to get many health issues, and those are the people who are likely to hook on more to these tobacco products. And in case anybody in the house is using tobacco products, say father is using or mother is using or brothers or siblings are using, in such families the youngsters pick up this habit. So, from the adolescent's point of view, we all know that that is the age wherein they want to experiment new things. They just want to try. Although they are aware, they just don't. They just don't shun away from that. They want to try. So this experimentation and that curiosity, what happens? So these things, pull them towards these tobacco habits. Also, at times we also see that celebrities, somebody is smoking on screen or using tobacco products on screen. So that appeals to these adolescents very fast, right? And they more than elders, they want to be familiar or they want to be one among the adolescents or their peer group. So peer pressure is again many times what happens in the school ages. They have formed groups. If one or two start using for some reason, others want to try it, or the others friends force them. So if you want to be in my group, you have to try. So these kind of factors, and films are there, media. So wide range of factors starting from the family. Okay, starting family, the school environment, the media, all these things influence tobacco uptake, and we should be aware about these things. That's very.
Right. Sir, as you have said that any celebrity can attract for the tobacco use. So is there any policy, and what are the other policies to prevent the tobacco use?
Yeah, I think this is a very good question, and people should be aware of this. Now, Government of India has taken several steps in order to prevent tobacco uptake among adolescents. Now, we started with an example of films, right? So we have one of the best rules in the world, the tobacco-free film rules. So if you're watching any movie, initially of a 30 seconds, there is a short video which is coming up there, which is showing in 30 seconds. It has quite a big impact. and there are, in case any actor or actress is smoking any tobacco product, so in those circumstances, there is a caption which comes: smoking kills, or smoking is hazardous to health, tobacco causes cancer, and so on. So and there is an EV disclaimer that in case they are using it also, it is not good for health. So this is the tobacco free film rules, and I think all the adolescents, parents may be aware of these rules. So this is one of the good rule which we have, unique rules what we have in our country. At the same time, any tobacco packets, if anybody has seen, there is 85% scary health warnings on them, with oral cavity cancer. Looking at that, anybody should think 10 times before opening that packet or touching that packet also. So that is one of the rules. And usually, what is observed is adolescents, they don't have much money with them. They have very small pocket money. They'll not be able to buy a pack of cigarettes or something like that. So they usually go for singles. So some of the states, including Karnataka state and other states as well, have enacted a law which says ban on the sale of loose cigarettes. So they're not supposed to be banned. Okay, and around the schools also. So there are rules wherein near the schools there should not be any tobacco products which are sold, right? And I think in the previous videos also we have seen that government of India has taken measures to ban ends, that is electronic nicotine delivery system, which is a really
Right.
wonderful rule, because we are tackling with the current tobacco products, and we didn't wanted any other new tobacco product to come up in the market. So that firm step has been taken. So
Right.
these all these rules just show how particular the government is concerned about the health of the people, and at the same time people should understand this. So it is not just the government's rules which will reduce the tobacco burden. The
Mm.
citizens, every citizen of this country should come forward and follow these rules. For example, ban on public smoking. So this, as a child, I remember in the buses or whenever we used to travel, there used to be bus drivers and conductors used to smoke. We couldn't say anything. Now
True.
rarely we see that. You might have also observed that. So that is one of the very important rule. Again, it will prevent the hazards of second-hand smoke. So anybody that's a smoker or using tobacco product should not use it in public places. That is again because adolescents tend to see somebody smoking, they're giving out the smoke. That attracts them. So because of
Right.
that curiosity mentality, they tend to use it. So this ban on public smoking is also one of the important rules what is there in our country. So several rules, as I mentioned, are playing a key role in preventing the tobacco uptake among adolescents in our country.
Right. So what can school do to ensure that adolescents do not start tobacco use?
Yeah, I think as I told you, adolescent age group is very, very crucial for developing good habits. And schools play a very important role, and thus education department also has a very pivotal role. As I told you with respect to rules, so there are some rules like in every school there should be a board that smoking here is an offense and smoking is prohibited. And outside the boundary wall or the compound of the school, there is a need for a board which says this is a tobacco free institution and nobody is supposed to use tobacco in the school premises. Further on, any petty shops which are there near the schools, those petty shops should not sell tobacco products for a distance of 100 yards. Because usually what happens in refreshments or short breaks, children do visit petty shops, and government has taken the rule says that none of the shops should be selling tobacco products, right? So all these rules which are there in the school, now what schools can do, that head teacher and the other school teachers can ensure that these rules are practiced in the school premises and in the vicinity of the schools. So this is very, very important. Now we have done studies where in some schools still we observe that. So this rule is there since nearly 2 decades. Now, I mean, as I told you earlier, it is everybody's responsibility. No, I'm not just telling it's responsible schools. I'll just come to other people who are responsible for it. And but then schools being at that age, tender age, for laying down the good foundation for the children. So that is very important. In order to effectively implement this, there are campaigns like Rose campaigns which are done. So these schools can actively take up. Rules are there, but then we want people to follow. The vendors in the vicinity of the school should not sell. So some I've seen in the reports as well. So school children handing over roses to these vendors, requesting them not to sell tobacco products. So rule is there, but in a very polite way, in a very affectionate way, they are educating or requesting the vendors not to sell tobacco products. Now there is a responsibility of vendors as well to comply with these rules. So whatever profit they are coming, they should be foregoing, because the law of the land doesn't permit that. Now, as I told you, 100 yards distance. Now this 100 yards, who is going to measure day in and day out? So there are certain best practices which say that there should not be there should be a yellow line being marked. So this is one of the initiatives, the best practices which are taken up. So for a distance of 100 yards from the school compound, a yellow line is marked, and that is a tobacco-free area. How many shops are there within that radius will be knowing, if the yellow line is there, that they are not supposed to sell tobacco products. Right? And schools form the center wherein awareness and knowledge about hazards of tobacco are given. So yearly, along with the health department, so these awareness programs should be compulsorily conducted with interest and with innovative, by asking them to do some role plays or some competitions. So this also helps a long way, and incorporating all these things, taking this tobacco menace as a very serious issue, the schools can contribute for tobacco control. And definitely wherever schools are doing this job, and their knowledge is good among adolescents, definitely we see that tobacco use is negligible in those use, or none of the children will be using tobacco products. So that is a role the schools can play.
Right, sir. And also, I would like to know the role and responsibility. As you have said, they are the responsibility of others also. So, I would like to know the role and responsibility of village or community in preventing
Yeah.
tobacco.
So I mean, every village nowadays has the gram panchayat. There are elected representatives. So in these gram panchayats, there is health committee also. We call it as village health committees. So I mean, they are also educated about tobacco control. So a recent development is that the government, or the rural development and panchayat raj ministry, is requesting or encouraging zilla panchayats of different districts to identify villages which are suitable to be called as tobacco free villages. Now there is a big role of these elected representatives, the gram panchayats, and in urban areas the ward health committees, to look into this matter. They can create regular awareness program, give the required knowledge. Now there are tobacco cessation centers available in various health centers. So if anybody is using, they can refer them there so that they can quit tobacco use, and at the same time encourage the vendors to voluntarily stop. Now, many times, whenever we go to communities, people say, "Why don't government ban tobacco?" Now, government has shown the eagerness to. The ministry has shown, with the help of several NGOs and other things, good rules are in place nowadays, and it is the responsibility of the people also to join hands with the government to follow the rules what are all existing in the country. So that now small villages, if they start declaring themselves as tobacco-free villages, every drop makes an ocean. So definitely, when I'm seeing now reports wherein few villages in every district are declaring themselves as tobacco-free villages. So if this happens, definitely it will be easy for the government to take further steps. So I feel the village committee should take lead in this, and try to ensure, create awareness, and then guide those people, those are already using, to tobacco cessation centers, and see to it that they are able to declare their villages, and they are model villages. They can be role models for other villages as well. So that is the role of these village committees and village and the communities.
Very true, sir, and very interesting thing you have told us. And the last thing I would like to know, that how family or friend can help in preventing uptake of tobacco, or for help in quitting tobacco. What is the role? There must be a role of family and friends and like community, as you have told us. But the family is the thing which is the most close to the person who is having tobacco. So, what is the role and responsibility of it?
Yeah, I think the major role lies within the family itself. Now, as I told you previously, there are several rules and regulations in the country. Be it ban on public smoking, okay, or tobacco-free film rules are there. 85% health warnings are there on every tobacco packets which are being sold nowadays. Okay, and the rules around the schools, not to sell tobacco products, all these things are there, and several studies which have been done are giving emphasis on the family now. So what are factors which are influencing these adolescents to start tobacco use is parental use. I mean, especially the mother is using smokeless tobacco, chewing tobacco, then the chances are much more than they picking up from the fathers. You know, so father using tobacco, mother, siblings, brothers or sisters using tobacco products. Then we see the younger ones picking up very fast. Again, friends are using, the risk of using tobacco is very high. Now, the parents or the family becomes a basic unit for anybody. In these circumstances, the families, the parents can be role models and they can educate. If I remember my adolescent, my parents, when I was in 7th or 8th, they used to advise me, what you may do anything, you may study well, you may not study well, that is secondary for us, please don't go near these habits. So that I still remember. So these kind of education schools have to do it, but then if it is reinforced at the homes, definitely that will have a double impact on this one, and they have to be role models. The parents, if they are role models, then definitely children also will stay away from this tobacco and other harmful substances which are increasing nowadays in the this one. Even friends that way, they can be supportive to one another, not to pull others into that habit. In case they have, due to some reason they develop that habit, there are facilities to quit, and they can also come forward, go to take those services and quit this particular habit. In this way, the family becomes a basic unit. We have talked about schools, talked about villages. Much more important and very crucial is the family. The parents should take this responsibility. So, as I told you, there's several people, vendors I told you about. So, this tobacco control or the tobacco endgame should be a people's movement. So unless every citizens participate in this, definitely all the government's efforts, the health department's efforts, the medical fraternity efforts will be fruitful. So that is very crucial, and everybody should take it to their heart and work for it. So that's my view on this.
Very true, sir. Government is government is making its effort, but it will not going to happen until unless we are take a move,
Yes,
right, sir? So I hope that after watching your video, the parents will be aware, the society will be aware, and the village and community as well will be aware of the tobacco use and will prevent the adolescent from the using tobacco. So it was very nice talking to you, sir, and very informative session with you. I hope that we will do a very next session with you very soon. So thank you so much, sir, for having talk with us.
thank you for the opportunity. Thanks to IAPS. Thank you.
Thank you, sir.